Hi guys, it's me, Dr. Nasir, back again in Let's Crack OET Together, as a lot of students showed support on my last video, which was on how to write a transfer letter, and they requested to make more videos on how to write different types of letter. So this video is very important. In this video, I will let you know about the complete pattern of OET urgent referral letter writing. How to write the urgent referral letter and how to convey information in your OET urgent referral letter and clear your OET writing in first attempt, scoring above 400 marks. If you follow all the tips, strategies which I will share in this video, believe me, you can also clear your OET writing scoring above 400 marks. If you want your letters to be corrected by me, or if you want any kind of preparation, you can visit drnasiracademy.com, pick up your desired course and ace your OET in your first attempt. If you want to personally contact me, you can contact me down on the number given in the description below. So before starting the video, make sure to like and subscribe to the channel and press that bell notification. And yes, without wasting any time, let's get started. So first thing, I will share some case notes of the OET urgent referral letter. So as you can see on the screen, you will be given 5 minutes of reading time in which you cannot highlight any information, you can only read. While during the 40 minutes of writing time, you can highlight and you can select your case notes too. So as you can see on the screen, the case notes say Mr. Ruth James was brought to the emergency department of hospital in which you are an emergency registrar. So now, either you are a doctor or you are a nurse. Make sure to watch this video till the end because the pattern of the OET urgent referral letter writing remains the same. If you follow it, convey the information logically, do not make mistakes related to the prepositions, capitalization, verbs, articles, commas, punctuations, you can easily clear your OET writing. So, the notes say Mr. Ruth James was brought to the emergency department of hospital in which you are an emergency registrar. Patient name is Mrs. Ruth James. Date of birth 12/02/1986. The address is 256 Park Avenue, New York. Social background: married, works in an IT company as a programmer. Family history: father is diabetic, mother and sister asthmatic. Medical history: asthma, since 20 years of age, takes salmeterol 50 mcg per oral inhaler BD. No known drug allergies. So here I'm going to mention one thing. Here, as there are the Roman abbreviations written like BD, so make sure to write these abbreviations in the complete format, like twice daily. Don't use the word BD, OD, TDS, QID or HS. Use the complete form. First visit is 25/07/2021, subjective, blunt injury isolated to face following fall from ladder when cleaning the ceiling, loss of consciousness, very important. Since she had a fall from ladder and she lost consciousness, in head injury, loss of consciousness is very important to mention. If you are skipping this loss of consciousness, you will be losing marks, as it is known as a critical information. Oriented and conscious on admission. Objective: dish face deformity, multiple laceration, dropped upper jaw, profuse bleeding from nose and mouth, both nares obstructed, breathing from mouth with difficulty. Periorbital edema. Vital signs very important. BP is on the higher side, 130/100, heart rate 86, respiratory rate 12, and saturation is 80%. This is something worthy to mention. Facial examination: 3 cm laceration on the nasal bridge, 4 cm upper lip laceration extended over face, tenderness in frontal and maxillary sinus. Bilaterally, orbital margin is tender and a floating maxilla is present. If we move on further, intraoral examination shows malocclusion, displaced both central incisors, mandibular and ear examination is normal bilaterally. Investigation: CT head, frontal ocular, important to mention, CT facial bones, fractured thyroid plate and orbital floor, GCS is normal, CBC, coagulation and electrolytes are also normal. Assessment, what is the diagnosis? It's a maxillary fracture. What is the plan? Very important. Nasotracheal intubation over a flexible bronchoscope, control bleeding, ringer lactate solution, augmentin 1.2 gram IV every 8 hourly, urgent referral to surgeon. So these things have been done in the hospital, and then what is your plan? Urgent referral to surgeon. Why? For restoration of functional occlusion, reconstruction of stable bony facial contour, intermaxillary fixation for stabilization followed by the rigid fixation of maxilla. So this is why you have to urgently refer. All the things you have done in the plan, and this is why you have to urgently refer to a surgeon. So now, what is the writing task? Write a letter to Dr. Thomas John Perkins, a maxillofacial surgeon in New York Medical Center, Queens, New York, for urgent surgical management for the patient. Now, as you read the case notes, you got to know that a lot of information is important. So now, let us start writing the letter. Make sure to stop the video, also write your letter, come back to the video and compare your written letter with my letter and see that where you are making mistakes. Either you are making the fragmented sentence mistake, either you are making mistakes in the making the run-on sentences, either you are making capitalization mistakes, the verb mistakes, the conveying of information mistakes. Where you are making mistakes, get to know it, because once you improve your mistake, you will be getting more marks. So now, if we start off with the date, October 14, 2023, this was the date, we left one line, came to the recipient address. Dr. Thomas John Perkins, maxillofacial surgeon, New York Medical Center, Queens, New York. Again, we left a line. We went to Dear Dr. Perkins. First time we used the complete name, as I told in the last video. In the second time, I used the last name. Now, regarding Mrs. Rules James, always see the title very carefully. Do not write Mr. Rules James. Mrs. Rules James, date of birth. Either you can mention the date of birth here or not. It's not an issue. But if you do not mention the date of birth here, you have to mention the date of birth at the end. So now let's come to one of the most important things in the OET letter writing, which is the introduction. As you know, well begun is half done. So the more better your introduction is, the more marks you're gonna get. So let us start writing the introduction. Introduction, as I told you in my last video, must comprise of three important things: the name, the chief complaint, and the purpose of the letter. Do not expand the purpose in the introduction. Your introduction should be small, crystal crisp, clear, and should convey all the information. So, I am writing to urgently refer. Here you show the urgency right at the start. If you do not show urgency in your introduction, you will be losing marks and you won't be able to clear your OET writing. So, I am writing to urgently refer Mrs. Ruth James. I didn't mention the date of birth in the regarding section, so I will write, comma, a 35-year-old IT programmer who has sustained a maxillary fracture following a fall from a ladder. I am writing to refer Mrs. Ruth James, comma, a 35-year-old IT programmer who has sustained a maxillary fracture following a fall from a ladder. Not fall from ladder, fall from a ladder. Use article, okay, before a noun. Your urgent surgical management will be highly appreciated. Well done. See, I conveyed the name, Mrs. Ruth James. I conveyed the chief complaint, that is the sustenance of a maxillary fracture, and I conveyed the purpose, which is the urgent referral for surgical intervention. Now, in an urgent referral letter below the introduction, the past medical history and past surgical history won't come. What will come? The urgent current condition will come in the urgent referral letter. The urgent current condition. what is the most urgent to mention right at the start. Not the past medical, not the past surgical, not the first visit, nothing. The urgent condition. This is called conveyance of information logically. So, let us start writing the body paragraph 1. Today, Mrs. James, so there will be a comma after today, okay? Or if you write initially, you have to write a comma after. Today, comma, Mrs. James was brought to the emergency department with blunt trauma following a fall from ladder. She reported loss of consciousness for 5 minutes after the fall, comma, yet she was well oriented on admission. On examination, she had a 3 cm laceration on the nasal bridge, 4 cm laceration on the upper lip, a dropped upper jaw, dish-face deformity, profuse bleeding, and obstructed nerves. See how I am conveying the information logically and coherently? So if you also do this thing, write like this, you will be scoring above 400 marks. Please note, she also had tenderness over her face and her saturation was 80%. Additionally, her central incisors were displaced and malocclusion was present. Subsequently, a CT scan of the head and facial bone disclosed frontal contusion and hemorrhage on the head and fractured pterygoid plate and orbital floor. Get to know this thing, guys. Whenever you start a new paragraph, the first time you will use the name of the patient and then you will use the pronoun. Do not start the paragraph by using the pronoun. It creates unclarity. So, Mrs. James has been intubated over a flexible bronchoscope for stabilization and her bleeding has been controlled. She has been put on a ringer solution and started 8-hourly regimen of augmentin. Below the introduction, you have mentioned the current condition, then you have mentioned what happened in the hospital, and now you can mention the past medical and past surgical history. In an urgent referral letter, past medical and past surgical history comes at the end. Get to know that. Please note, Mrs. James has a past medical history of asthma for which she takes 50 mcg of salmeterol twice daily. Now, you will leave one line and you will write the conclusion. Conclusion consists of explanation of the purpose. Given the above, I am referring Mrs. James to you for restoration of occlusion, facial reconstruction and fixation of maxilla. You left one line. Should there be any queries, please do not hesitate to contact me. Yours sincerely, Doctor. So this is how you write an urgent referral letter. Make sure to share this video with your friends so they can also know of how to write the urgent referral letter correctly and clear their OET writing. So that was it for today, guys. If you want me to make any specific videos on any different subtext, you can comment down in the comment section below. That was it for today, guys. Bye bye until the next video.